everyone, and welcome to NHIS in a Week, where we give you the highlights in the authority and the scheme. My name is Shanice Palm. Now to the headlines. NHIS Campus Connect promotes students' well-being at UCC. Interpol commends NHIA for supporting child protection investigation. And Honorable Dr. Zanato Ajiman Rawlings inspires young NHIA professionals. Now to our first story. The National Health Insurance Authority continues to take healthcare education and services directly to tertiary institutions through its NHIS Campus Connect initiative. At the University of Cape Coast, students were encouraged to prioritize their health and well-being while pursuing academic excellence.
The Chief Executive of the National Health Insurance Authority, Dr. Victor Wasare Bampo, has urged students to make their health a priority as they pursue their academic and professional aspirations. Speaking during an NHIS Campus Connect engagement held as part of the University of Cape Coast SRC Week celebrations, Dr. Bampo said access to affordable, quality healthcare is critical to academic success and overall well-being.
Well-being cannot exist where access to healthcare is uncertain. So as a student, you cannot focus in the lecture hall if illness becomes a distraction. A dream cannot thrive if healthcare becomes financially inaccessible. And a society cannot fully prosper when quality healthcare remains a privilege rather than a guarantee. So at the NHIA, we believe that healthcare should not be a luxury. It should be accessible, reliable, and responsive to the needs of every Ghanaian, including the young people gathered here today.
He encouraged students to pay attention to both their physical and mental health, stressing that success depends on maintaining balance while navigating academic pressures and future aspirations.
I think that well-being means more than academic success. It means finding balance in a world of increasing expectations, navigating uncertainty about the future, managing emotional pressures, and protecting your mental and physical health while pursuing your dreams.
Held under the theme, Promoting 21st Century Well-Being, a holistic approach to mind, heart, and soul wellness, the conference brought together students and health professionals to discuss issues affecting young people. The NHIA also used the opportunity to educate students on the benefits of the National Health Insurance Scheme while providing on-site registration and membership renewal services as part of its Campus Connect initiative.
Moving on, the International Criminal Police Organization, Interpol, has recognized the National Health Insurance Authority for its contribution to an international investigation that rescued child victims from online sexual exploitation.
Interpol officials made the commendation during a working visit to the NHIA head office in Accra. The organization praised the authority for its prompt response to intelligence requests, which helped investigators identify victims, trace their location, and arrest suspects involved in online child sexual exploitation and abuse. Receiving the delegation on behalf of the Chief Executive, Dr. Victor Wasare Bampo, the Deputy Chief Executive for Operations, Dr. Senano Kwesi-Jokutu, reaffirmed the authority's commitment to supporting lawful investigations that protect vulnerable people, particularly children. He also highlighted initiatives including the establishment of the NHIA Gender Desk and efforts to strengthen collaboration through responsible data management. The visit reinforced the importance of interagency collaboration in safeguarding children and combating transnational crime.
Young professionals at the National Health Insurance Authority have been encouraged to invest in continuous learning, build meaningful professional relationships, and prepare for future leadership.
The advice came from Member of Parliament for Korle Klottey and NHIA Governing Board member Honorable Dr. Zaneto Ajiman-Rawlings during the closing ceremony of the NHIA Youth Mentorship Program. She encouraged participants to build strong networks, remain financially disciplined, and support one another throughout their careers. Dr. Ajiman-Rawlings urged staff to focus on creating lasting impact while preparing themselves for greater responsibilities within the authority.
When you see a problem, start thinking about a solution. Nothing makes your supervisor happier than a person who brings a problem and a solution. That means that not only have you recognized the challenge, but you've had a moment to reflect on what are the ways that that can be addressed. Don't think yourself too small or too young to contribute towards decision making. There's no such thing as leadership for the future for anyone in this room.
Chief Executive Dr. Victor Asare Bampo also commended the participants for their commitments and encouraged them to apply the knowledge gained to improve service delivery across the NHIA.
Think about the mindset shift, positivity. The second is the focus shift. Please, let us focus on our work. Let us focus on being different. And the last one is the reality shift. We live in a different world now. Use the tools that you know how to use to make the world a different place.
The National Health Insurance Authority is stepping up stakeholder engagement ahead of the nationwide rollout of the One-Time Attendance Code, known as OTAC, a digital innovation designed to strengthen healthcare service delivery.
As part of the pilot phase in the Asinafo North District of the Ahafo region, NHIA officials engaged district assemblies and district health directorates to build support for the initiative. The OTAC platform, which forms part of the National Health Insurance Scheme Electronic Health Facility Attendance Management System, is expected to reduce fraud, eliminate illegal charges, and support the implementation of the free primary healthcare program. Stakeholders welcomed the initiative but expressed concerns about poor mobile network connectivity in some rural communities. In response, NHIA assured stakeholders that alternative arrangements would be available where connectivity is unavailable, while district call centers and support desks at health facilities would assist members in generating OTACs and updating their information. The authority says sustained public education and stakeholder collaboration remain essential to the successful implementation of the initiative.
To a final story, the National Health Insurance Authority has extended healthcare support to Ghanaian citizens returning home from South Africa by enrolling them onto the National Health Insurance Scheme immediately upon arrival.
NHIA officials were at the Kotoka International Airport to register nearly 350 Ghanaian returnees who arrived aboard a government-arranged repatriation flight. The team, drawn from the Corporate Affairs Directorate, the Greater Accra Regional Office, and district offices, worked through the night to enroll the returnees and activate their NHIS memberships. The intervention followed the directive from the Chief Executive of the NHIA, Dr. Victor Asare Bampo, to ensure that returning Ghanaians have immediate access to healthcare services. The authority says the exercise reflects its commitment to ensuring that every Ghanaian, regardless of circumstance, can access quality healthcare through the National Health Insurance Scheme.
Let me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, So you people are here to test my faith, eh? Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
That's all that we have for you in this week's edition of NHIS in a Week. For more stories, do visit our social media handles displayed on the screen or visit our website www.nhis.gov.gh. Do have a lovely week. My name is Shanice Palm.